Have you ever felt dismissed by your doctor? Well, you're not alone. Women's health usually goes overlooked, misdiagnosed, and underrepresented. But what if there was somebody in your corner who not only knows exactly what you're going through, but is working to help women understand their body and make sure that they know that they're not crazy and they're not alone? And that's what today's guest is doing. And I'm so excited to talk to her. Dr. Tara Harding, she's a true force in women's health and fertility. She's a doctorate family nurse practitioner and global fertility coach, changing the conversation around women's health care and medical gaslighting. That's right, there's a lot of medical gaslighting going on. She's the founder of Simply You Clinic, a private practice putting you in control of your healthcare. Dr. Tara has been featured in BuzzFeed, Today's Parent, and many other media outlets, and her viral TikToks, often reaching over 15 million views, have made her the trusted voice for women worldwide. She's also the host of the hit podcast Hopeful Hints, where she empowers women to understand their bodies, advocate for themselves, and find hope on their fertility journeys. In addition, she's the author of the book called Beyond Doubt. Dr. Tara, I could go on and on with your bio because
Ah,
it's so accomplished, but thank you so much for joining me today.
thank you for having me and opening up some great conversations that are long overdue that we're about to have.
They really are. I was going through your Instagram, your personal Instagram, and your clinic's Instagram, and I feel like every story in reel, I was raising my hand saying, "That's me. Yeah, that's
Oh,
me. That's my friend," or "Oh my gosh." So we have a lot to dive into, but I want to start with your journey. If people aren't following you, I know that you're very vocal about why you got into what you're doing, but take us through why you ended up here.
yeah. So it all started as I was practicing as a doctorate nurse practitioner in my hometown. I was serving rural health, very, very diverse. I was working ER, hospital, clinic. So nothing even close really to what I'm doing now. And I had finished my master's in doctorate and I was like, all right, hit that button, right? We're going to have a family now. It's going to magically happen. And it did not magically happen. In fact, there was miscarriage that came along with that. And it was soon that I entered the healthcare arena as a patient from a provider standpoint. And I saw so many and missing links and just this is seriously how this is, from a patient perspective. And so I started my fertility journey, and that was where the medical gaslighting, and I didn't know what that word was at that time. It wasn't until I had went through therapy years later and realized what was going on. But I will never forget, I had just experienced a miscarriage, and 2 months had went by. I reached out to my healthcare provider. She wasn't available, so it was a colleague of hers. And she had said, when you're crazy enough, that's when we can start IUIs for your fertility journey, because you're going to have to drive 2 hours one way. So, and as little did she know, I was already in therapy at that time because it had been
Wow.
well over a year of trying to conceive. And the miscarriage, and I had just had so many questions, I'd put myself into therapy. And I was so caught off guard by that comment. And my provider was like, you know what, you're done with our practice. Let's just get you into a reproductive endocrinologist. And other things had happened along the way too, through my IUI journey. One time the provider came on the call and was like, hey, Kristen, how's it going? Let's go over your ultrasound today. And I was like, my name's Tara. So that's not the right ultrasound. Like, who knows to this day? I still don't know if that even was like the correct, if she changed her screen and quickly found my ultrasound. I don't know, but that IUI did not work. I had hit paused, and really reevaluated. And I had met a family friend of ours who worked as an embryologist, ironically, and learned all about IVF. And we went down that road. But that road led to a pregnancy, thankfully. But at 32 weeks, I started bleeding. I woke up, it was the week of Thanksgiving, and had large amounts of blood, and I was supposed to be on call for the ER in 30 minutes. And I remember sitting on the toilet going, do I call my doctor first, or do I call my healthcare facility, because I call for the ER in 30 minutes and there's no way I'm going to be there. I was very torn, which sounds ridiculous, on which phone call to make. And so I actually called the provider and said, hey, I'm not going to be in. I'm bleeding. I need to go 2 hours away to my OBGYN. They covered, obviously, and I started driving. And my OB called back and said, get to the closest hospital. We're sending a helicopter. And I was like, no, I can make it. Like, I know how dispatch works, how long this whole process takes. I can drive there faster. She goes, it's not about you. It's about this baby. Get to the ER. And it was like, in that moment, I was like, oh gosh, okay. So again, blessed. 3 days in the hospital, nothing was found. So I had no answers though. So I had my diagnoses of infertility was unexplained up until that point. I had now had a expensive helicopter ride, 3 nights in the hospital, nothing found, unexplained, assumed placental abruption of some sort. Couldn't go home. They pulled me, wasn't allowed to go back to work, and that was at 32 weeks. Baby comes at 39 weeks, end up in an emergency C-section where my recovery was awful. From the minute, in fact, the minute I went back, and women can maybe relate, but the shaking, like I had this, like my whole body was shaking and no one ever explained to me what the heck that even was going on. And then I went home and I felt like I had the pain was immense. And I just couldn't understand how women elected and scheduled C-sections. Like the amount of pain I had was just, I just couldn't understand that that was what women chose to do. And then I felt flu-like. And I had, oh, there's no infection, nothing to, okay, why do I feel this way? Well, you're just, it's just, this is just how it is for some. And it went on and it went on 2 weeks, 4 weeks, 6 weeks. You just have crap luck. That was the sentence I eventually was met with. Like, you just have crap luck. Do you want some birth control? I just went through years of infertility. The last thing I want, no matter what, is birth control. Like that, like that's what you're offering me. And I'm breastfeeding. And like, it was like breastfeeding kind of was a disaster at one point too. Well, I don't know. There's some consultants. I just did not have a lot of help and resources. I lived 2 hours away still at that point. And so I remember just feeling awful for 6 weeks with no answers. Fast forward, got my first menstrual cycle at 12 months postpartum, and I couldn't physically stand up and walk. Like, I cannot explain it other than like my legs could not stand up, the amount of pain I had. Thankfully, I saved some medications from my C-section to help get me through that. And when they kicked in, I mean, the amount of like blood and pain until I could walk again, I was met with, here's your birth control. You just have crap luck. I'm sitting here going, how am I the only one going through this? Because the only thing I've ever heard up to this point was how great C-sections were. And like, this was a breezy thing. I'm scheduling it again. I'm going to put my makeup on, for this birth and all this. And I am feeling like garbage at every section of this way. Fast forward a couple years, did an interview on my podcast during March, which is Endometriosis Awareness Month, with a excision specialist for endometriosis. And it was within that 45-minute, whatever it was, 60-minute session, I sat there and diagnosed myself with endometriosis, adenomyosis. About 2 years later, I was in his OR with stage 4 endometriosis and adenomyosis. So it was like a decade later that I had finally had answers to what I had been through, and so much more. But I had constantly just been met with these like, you're too busy, slow down. Like, this is just how it is. You have shit luck, stuff, these just weird comments from my healthcare team who I had thought I was very close with, but could never give me answers and dismissed me more than anybody I know.
Your story sounds familiar to a lot of people I know when it comes to anything really regarding our healthcare. I was telling you before, I was talking to my doctor and they just said, well, you need to slow down. Or I had gut issues and, for years I was in extreme pain. And they said, well, it's IBS. Try not to eat gluten, or, just try not to be stressed, or take some Metamucil. I'm like, what? This is I finally did. I found a nurse practitioner who she specializes in holistic, but also regular practice. So they got to the bottom of it because they did tests that the doctors never did. And for the first time in years, I finally felt better. But I feel like, Dr. Tara, that so many times when we go to the doctor, if we hear the same thing, then we start to think we're crazy or we're stupid or it's just in our head, or just live with it. And so it sounds like that's kind of what you went through. And then you finally got the help you needed, which the endometriosis would explain the infertility.
Oh, 100%.
And, and so then what? Then you decided, okay, I don't want other women to have to go through what I've been going through.
Yeah. So the big C word hit, and I was working front lines in the rural healthcare facility. I was burnt out, very burnt out of my job. Again, there was 3 nurse practitioners on a good day running an ER, hospital, clinic, nursing home. I remember my first 9 months of that job feeling very burnt out, but this at that point was about 7 years into that job. And I was like, there was this thing, I was like, fertility coaches, what is this? I was like, I feel like I could help women with what I've been through. I had started a nonprofit first. So when I went through this, there was no support groups, no financial assistance. I had no insurance coverage through this too. And so as a healthcare provider, I didn't understand how someone could be like, here's unexplained infertility. Oh, by the way, there's no insurance coverage for this. So I started with a nonprofit that served the state of North Dakota, and it still exists, with support groups and grants and just resources for those going through it. And then I brought forward legislation. So since 2019, I've been working with North Dakota state legislature and at the federal level to really push this to get insurance coverage and raise awareness on the cost of the meds too, because the med prices are insane. If you use your insurance, the prices go up versus cash pay. It's just a whole thing. So I started with that, still do that. But I then transitioned in 2021. I was like, I could probably start a little telemedicine business. I don't know how this works. So one of my friends really encouraged me, really pushed me and guided me. And she's like, just start in your basement, do evenings and weekends. So I got licensed in 3 states and just started doing telemed, helping women with infertility. Then it turned into all the women's health things, like name a health thing a female was going through. And like, I was helping them with that. Then I was like, well, I can't do your yearly exam on telemedicine. That doesn't work with the speculum. So let me find some space here. And I ended up renting space 2 hours away, where I got my undergrad from. My friend, that was the same friend who helped me get my business off the ground. She's like, just come use one of my exam rooms and you could, a couple days a month. So I did that. And then it was like, help my son, help my daughter, help my husband, my neighbor, my grandma, my sister, and it just really blew up. But what I did was allow time. So I wasn't restricted on time. And I realized that when women were in a position where they could cuddle up with a blanket or be in their bed or be on a couch or in a comfy chair with coffee, tea, they really just opened up more. And I got more details out of them that led me down paths to help give them more answers and run more diagnostic tools. I had done some advanced training in all areas, from fertility to integrative health to everything too. And I think something you said was very interesting too, is you can go get these advanced testings, but I always tell patients, I'd be very cautious if you tell your traditional healthcare provider, they're going to gaslight you about those tests. So just hang out over here with us. You can go back to them if you need, but like, I'm warning you, if you tell them you're getting those tests done, they're going to say that's garbage, crap, doesn't exist, doesn't work. They're scamming you. You're going to hear every sentence in the book. So then these patients wanted to just see me for everything, sick visits, and they didn't want to leave. Now I had kind of changed the setting. There's lamps, there's couches, there's rugs. It felt more like therapy, but yet a spa. I really tried to make it feel like a spa. And then the load became too much, and I realized I need to add a mental health care provider because that was really important to me. I didn't know how to run a business, and so I got enrolled and I was very blessed. I got to do the Goldman Sachs 10K business program. That was at the end of 2023, January 2nd of 24. I hired my first psychiatric mental health nurse practitioner, and now we're up to 10 providers. We got a staff of 20, building a clinic just to really reinvent healthcare from every sense. I want smell, sight, touch, sound, everything in the room and the experience to just be different, because healthcare should be that way, the way healthcare should be. You should be welcomed and warm. But I really realize when your environment is different, your experience is different. People take their shoes off, they sit on the couch. I got blankets if they want. I mean, it's a whole experience that really just allows them to open up and truly share everything, because we need to know everything. I need to know if your nose is running. Do you have rectal pain? Are you losing hair? Like, I can't leave a stone unturned in order to truly figure out why something might be going on and go down the right path. So we've really just expanded that and expanded our telemedicine into more states too.
Love it. I would love to come and be at your clinic. I think I
Yes,
was
I'll invite you to the grand opening this summer. You can come join and hang out with us.
Yeah, and something, you said, I think you had mentioned, if you tell your doctor you have these tests, they're going to gaslight you. Yeah,
Yep.
literally happened to me. And my daughter, because she was having stomach issues, she did the same thing, went through, and the doctor referred her to a specialist, and we brought all these results. I mean, it was like a full, like, candida, overgrowth, all this stuff. And she's like, I'm not really familiar with this. And she literally said, let's give you a colonoscopy and take Fiber One or Metamucil. And I'm like, she's 19.
No.
Like, what?
Metamucil. Don't, if you're taking Metamucil, please just stop it. Like, just be done with the Metamucil.
You're literally trying to just mask the problem, and you're not getting to the root of the problem.
Yep.
And I definitely see it now, but I don't know if others see it or they just, again, they think, okay, well, maybe this isn't real. And something I saw too is that, you look at lab results, but you go beyond, the lab results. And I think that's the thing too. We'll get labs done and the doctor will be like, looks normal. Well, what is normal? Is it like higher or low? Is it in the middle? Like, what does that mean? So talk to me about,
Yeah.
for example, let's talk about perimenopause. I'm kind of jumping all over the place, but that is near and dear to my heart because I feel like I'm going through it. And I've had doctors tell me, go on birth control. That's what one doctor told me because my periods are normal and I'm not having hot flashes, but I'm waking up at 3. I'm super anxious. I want to cry, but then I want to laugh. I don't know, losing hair, all that stuff. But I still have my
Yeah.
period. So just go on birth control. Another doctor told me take progesterone. Another doctor told me take both. It's very confusing. And I feel that we are in this world where there's so much information. But
Mhm.
if I was a patient coming to you saying, I think I'm going through perimenopause, what should I do? How would you handle that new patient?
Yeah. So the one thing that patients, and I don't know if providers forget this too, lab ranges are huge. They're like this big, and they were actually designed. In every clinic you go to, here's a red flag, right? They're all different. Like, I don't think one lab has the same reference range. They were also developed. When they were developed, they included sick people, old people. They were not young, spry, healthy people in the development back whatever year it was when that came to be. We follow normal isn't optimal. That's how we were trained. And we keep our labs tight, but we most importantly treat you, the patient, and your symptoms. Labs are one piece of it. Most providers are treating paper, which is ridiculous. They're treating a piece of paper. They're not even looking like, are you more on the high end? What does that mean? If you're 5 points from going off, what does that mean then? Treat that. If it's 5 points from this way, what does it mean? Treat then. So it's very, I feel like, taking it back a step and looking at the patient and saying, hey, what do you have going on? So the first thing I do is rule out other things. Do you have thyroid issues? Do you have gut issues? Because if I give you, whether it's a supplement or medication, and you have a gut issue, how are you going to absorb that if your gut is trashed and there's all sorts of microbiome stuff going on there, right? Like, that is such a like duh thing that I don't get why GI docs are even in denial about that they forget what the microbiome is. Then we rule out like iron deficiency anemia is so underdiagnosed in women. The ferritin levels are a piece of it. Iron levels are a piece of it. So we rule other things out too, and we love giving bioidentical progesterone. So the other thing that patients need to remember when we're talking perimenopause and menopause, we freak out. We're thinking, I can't have hormones because of cancer, no matter what. That is instantly where we go, and that is to a very, very, very poor study that has just been debunked, let's just say, recently by the World Health Organization, and all of that had debunked this whole thing, saying, actually, we messed up, like, actually. And so we're trained and have all of these studies that show bioidentical is actually safe. We can prevent cancer. We can prevent cardiovascular disease. We can prevent dementia and things like that when we're using bioidentical. Now, a lot of the studies are sitting over here. If you go to your traditional provider, you're going to be given synthetic. And that is where the blood clot risks, the cancer risks lie, right? The synthetic, that's where the studies show those things happening. They were using those products. They were not using bioidentical. So really encourage patients to get familiar. And we actually have a book that we sell or hand out at our office to really walk patients through normal is not optimal. Testosterone and not being scared of testosterone, whether you're male or female. Fun fact, we give it to our females too. If we're done having babies, we can give you testosterone in perimenopause, and the benefits go libido. We don't talk about libido. Like, I wonder how many women listening right now have no libido, haven't had one for years. It's like, and they're told, go get a smut book, download this app. Is your husband cheating? Is he taking the garbage out? Like, you're met with the most ridiculous comments. Like, I would love to see those providers' personal lives that say those things. Like, and how they feel. I would love to know how the gaslighting healthcare provider truly feels themselves. Like, it is not okay to not feel okay, and that is very subjective. So I tell patients all the time too, we're going to try some things. We go as fast or as slow as you want. I might throw the kitchen sink at you, but in perimenopause, I do love bioidentical progesterone at bedtime, and I love low dose naltrexone. It is my unicorn dust. I should like wear a shirt, I think, at this point that's like, I love low dose naltrexone. have mine sitting right here. Like, I'm such a weirdo about that. I get made fun
What
of
is
about
that?
it.
What is that? I know what the progesterone is that,
Yeah, so we talk about the 3 best friends: hormones, insulin, and cortisol in our practice, and then I add on thyroid and iron deficiency and, right? But cortisol, so there's a receptor in our body, and cortisol attaches onto it, and now we're waking up at 3 AM, we have headaches, we have joint pain, body aches, anxiety, like, there's a whole 150
yes, yes,
different things.
yes.
Check, 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 right? Like, could that be hormones? Sure, but it could be cortisol too. And so this is a very, very low-hanging fruit, very minimal side effect compound. It's compounded. So people get freaked out because if you look up naltrexone, that's used in the addiction space at a very high dose. I use the word microdosing a lot for a lot of things: GLPs, peptides, low-dose naltrexone, hormones, whatever. And it blocks that receptor site. So it comes in and takes that spot. So cortisol has to kind of figure itself out down here. So you'll get a very quick, for many, many people get a very like, I'm sleeping right away. My mood is better. It works very, very good for many things. It can be even used in kids. So we have a pediatric portion of our practice too that, we use it in too until we can kind of get the system to calm down. And then the hormones balance, and then the insulin balances. So it's kind of a chicken or an egg thing too. It's a fight or flight blocker. So if you're in fight or flight like this all the time, sex hormones are not needed. Your body does not actually know if you are being chased by a robber or if it's just your notifications pinging you. Like, it doesn't actually know the difference. It is in a fight or flight. So it is a beautiful thing to turn the fight or flight off that I will forever stay on. Myself. I come off on weekends sometimes.
I've
But
never heard of that.
yeah.
That's good to know because I feel like I'm always running from a lion or robber or something.
Yes. It's my stopper to that. Like, I'm like, "I am safe. Take this." Yeah. It's my little hack.
Love it. That's great. You mentioned thyroid, and I feel like that is an undiagnosed
Oof.
issue. I
Yeah.
remember I had my first daughter, and I'd gone for like my checkup, and I'm like, I'm so tired. I thinking, well, I have a baby, I'm working. She was so grateful. She's like, let me check your thyroid, and she did, and it was like typo, so it was way off. But I feel like many times people, or they get one thing tested, and they're not getting the free T3, or I think there's like three
Yeah.
things test for.
Yes.
But I feel like that is a huge um, underdiagnosed issue that women have.
It is. I mean, I probably should this is a book our staff lives by. It's like, shout out, I call him Father Neil. Like, that he is the father of, I feel like, normal isn't optimal, but I want everyone to go grab their hormones right now, grab their thyroid, and look, did you even get a free T3? Did you even get a free T4? Did you get a TSH only? TSH tells us one little thing about what's going on, and the range is huge. Everyone's range is so huge. And in women's health, I think there's in the fertility OBGYN space, a pretty good, like, if it's 2.5 or higher and we're going through infertility or pregnant, we have to treat that. Like, I think that's a common thing. So I'm going in my head, why are we not always treating? I've thought for over a decade before I even entered this space, like, why are we not just treating that all the time? If a female comes in with symptoms of hypothyroidism, why don't we just treat that? And so I started treating that and saw great things happen. Went on to get trained further in this topic, and your TSH is kind of like the voice. And so it's just saying, make more T3, make more T4. It's not telling us if that's actually happening over here. And then we assume the body's in the perfect condition to convert free T4 to free T3. And many of us, that is not happening for a multitude of reasons. And so I can't tell you even how many women are on like levothyroxine or a thyroid med, and it's not even working. Like, you still are having almost every symptom of it. Your levels aren't where they should be, and you're on 112 mics of it, right? Like, you're like maxing out. And so we really hit that differently too. And I encourage every female listening to find a provider who has advanced training in the thyroid and believes in the thyroid. I'm just going to say it. I don't even care. Endocrinologists aren't where it is. They are not treating this appropriately. Find a provider that believes that normal isn't optimal and treats free T4, free T3. Most likely that looks like putting you on something called like desiccated or natural thyroid, where you're getting T3 and T4. And it's been adjusted based on how you're feeling. We're not going to look at labs all the time. We're probably going to put you over the charts on some of them. But if you feel better, like this just happened to a male patient in my practice. I'm covering for my provider who's out on leave. And the primary care provider drew labs and said, "Stop, your free T4 is too high." And I said, "Do you feel fine?" I didn't draw the lab because I'm not going to go drawing if we feel fine. That's our rule, unless we don't feel good, right?
Yeah.
And I said, "Do you feel well?" He's like, "I haven't felt this great in a long time." I said, "Then we aren't touching anything. If you're like, you can, I always say, pick a horse. What horse are we riding? That their horse, my horse. You can't do both. Your legs are going to go like, you can't ride two horses at one time here. So if you feel fine and good, just come to our follow-up as previously scheduled. Keep taking the med as per, because thyroid will do this too.
Oh, yeah.
Tomorrow it could be back down into the low range. So I don't know why that person felt the need to draw it. Stop drawing. Like, if it's not your med you're managing too, that drives me nuts. It's like, are you managing that med? Do you know why they're on that med? Like, stop telling people low dose naltrexone and bioidentical hormones are bad when you're not even trained in that area and you didn't start the med. So I get a little spicy nowadays because we have met a lot of providers who have personal bias and like our training, they just refuse to look at the updated research. And I really encourage healthcare providers to get updated, find some time out of their busy days and say, what the heck are these providers doing? What are they learning? What are they doing? And maybe expand your biases a little bit to not be so
Well,
biased.
that's why doctors like you are doing so well. That's why you went from your basement on the weekends to now this new space and even a bigger space in a couple months
Yeah.
because we're educating ourselves and we're realizing, okay, wait, we don't have to go to this doctor who's in our town. We
Yes.
can meet with a doctor or nurse practitioner in California or Texas. And if they take us on or they can coach
Yep.
us. And that is the beauty of what you're doing. And I'm so happy that I found you and happy that people listening and watching are going to be able to follow you, get your book, listen to your podcast. If anything, just follow you and understand, what's happening to their bodies and they're not going to feel crazy. My friend just went on testosterone and she was
Yeah.
joking. She said, if I start to grow a beard, Allison. So I saw her a couple of
Promise you won't.
facial hair. Yeah, you're doing good.
Great, girl. Keep it up.
Feel better. And I said, well, yeah, because obviously you're with the right doctor that's listening to you. You
Yes.
mentioned peptides and microdosing. That seems to be the big rage right now. I know on
Yeah.
TikTok I've been seeing a lot, and people swear by them. Give us a little bit of information on that.
Yeah, so in short, there's multiple different peptides and they all do something a little different. They are short chain, they're amino acids, and they're building blocks that make up different proteins in our body, long and short. And they act like little messengers to the body. So they tell cells what to do, and they each have a very specific job. So that's why you'll see different ones out there doing different things. So from tissue repair to help producing or optimizing or enhancing hormones to reducing inflammation. And so they do, oh my gosh, so many things from like muscle recovery, tendon repair, sleep quality, energy, metabolism, skin, collagen, inflammation, immune hormones, fertility, like the whole thing. And so I just have to giggle and like I haven't been very open about this, but like shout out to the provider who turned me into the board of nursing for my podcast on peptides. Like it went nowhere because there's nothing illegal. I'm doing nothing illegal or inappropriate. Again, you're just a provider who's not educated on peptides. Like patients, like you said, are out there on social media. They are listening. They want to know more about this. They are ready. This can even be used just to optimize, enhance their longevity medicine too, right? Like patients want this, and there's providers who are very educated on this, doing this, and you can choose to be in the dust and left behind, or you can choose to be up to date. Really going after providers who are just advanced and up to date is ridiculous. So I love peptides too. And then like PRP therapy, you and I kind of mentioned too, it's another therapy I brought in lately. And that's platelet rich plasma. And there's so many different things coming out on that. It's using the aesthetic space. But what we do is we use your own platelets. And we have a company we work with, and we actually test your platelets to dose your PRP that day to stimulate healing, reduce inflammation, support tissue regeneration. So we do it the studies coming out on autism for kids on this, on long COVID, and just I have people who are off their thyroid meds or reducing their thyroid meds and autoimmune conditions. It can like help use too, but using your own biology. So it's very low risk, very compatible because you're using your own body for it, but it kind of resets. It hits reset on pathways and inflammation in the immune system. And so a wide range of conditions that both these things can really help and enhance. And side effect profile wise, very minimal, very minimal. We have tips and tricks and ways we help with that too. But yeah, just lots of cool things coming out to really optimize, enhance, and support everything else that patients might already be doing by using their own body.
Is that the true dose? Is that what we're
Yeah, that's the true
Okay,
dose. Yep.
that's true dose that you offer. So you simply use their so you test their blood, and then that kind of helps you figure out, like, what they need?
Yes. Yep. So we have protocols based on why they're coming in. So we'll just use thyroid, for example. We have like a Hashimoto's protocol, test your platelets. And then the machine tells us based on your platelets and our protocol, here's how much we need to give back to you of your own PRP. And so it's only 4 treatments in 1 year. They're 8 weeks apart. So it's really not this like, weekly, daily, high intense thing too that can really optimize. I got it because social media, the power of social media. I shared my fertility journey. Someone from Idaho reached out and said, "Hey, have you heard of this?" And I was like, "No, tell me more." Told me her story coming off thyroid meds, had done every supplement in the book. Every provider, Eastern, Western, nothing working, did 4 rounds of this and swore by it. So it really can complement too. If you're somebody who's like, oh my God, I'm on all these supplements, nothing's working, it's an option to try too by using your own body to reset your own body, heal your own body with your own body. And so we have, a company that we use. We're bringing in exosomes next for things. So I'm always like, don't send Tara to a conference because I just got back from one and I'm like, we're getting this and this and this and like all of these things that why not? Like, why not be offering some of the latest technologies or pivoting how we do processes too within our practice?
What is it? What'd you say? Exosomes?
Exosomes. Yeah, that's a whole I feel like I could do a whole it's similar to PRP, but using a different, not from your own body, but like a derivative, a safe growth plant or Morton jelly, or using some other derivatives too to help heal and do cool things too with that. So that's a whole thing.
All right, I can't wait to follow that on your social.
I'll share, I'll be sharing about it. I'll be the first. I'm like, at this point, can I just use my body as an experiment? Like, I'm just here to sign me up. What's next?
Well, and I think that's what people love about you, and why I think that they work with you, because you have shared your journey on social media. You shared your journey of infertility and what you've gone through, and I think that's why so many people with fertility issues come to you, because you know firsthand. And I told you before we started recording, I had an IUI with my second and an IVF with my third, and I was so fortunate that the one embryo it took and we got pregnant, and besides hyperstimulating, that was interesting.
Oh, that's not fun, friends.
But yeah, kind of similar situation. I went into preterm labor with her and I was like, no, oh my gosh, this can't happen. And then went from bed rest to her being a week late. Go figure.
Yeah, I bet she's spicy too. My little
Yeah.
critter is so
Yeah.
spicy. I love him.
And that was, and she just turned 13. So I don't feel like back then there was much information out there for us. And I know, firsthand going through it. I mean, not only are you like physically feeling horrible from all of the hormones and everything you're injecting yourself, but you're emotional wreck. I mean, I feel like every place I went, somebody was pregnant or somebody had kids.
Yes.
It like takes over. It just takes over your life. Are we seeing an increase in infertility, or is it that we're just talking about it more? So sorry.
I let's start with that. I'm gonna go see all of the above. I do feel there's something making infertility be more prevalent, and I do also think it's because we're talking about it more, so we're getting better statistics. Like before, people just quit or didn't go in or just gave up or couldn't afford it or what have you, and so we didn't have the statistics to put at 1 in 6. It's probably like miscarriage is 1 in 4, infertility is 1 in 6. I'd say infertility is probably 1 in 4, honestly, as well. And I mean, maybe it's just guys see it all the time. I want to say something that I feel many women need to hear, and I needed to hear it too. But you said when you're going through infertility, everyone around you is getting pregnant, and Susie's putting her baby shower online, and like she's on her 5th kid, and like you have these icky thoughts that roll through your head. And I really tell women to just allow them. You're not a bad person. You are going through a disease that actually, and I can say it again after this weekend at the conference I was at, um, A is just as stressful. We have studies that show this is just as stressful as going through cancer treatments, going through the loss of a parent. But I got to meet Tara Lipinski, the figure skater of my time, and like got to listen to her talk, but got to meet her, talk to her. Lovely, lovely person. But she shared that going through infertility is much more stressful than training and going through the Olympics and winning gold. So like now we have this whole other chunk where like you're doing something harder than Olympic athletes, or the mental and physical of going through infertility. She said is nothing compared to going through infertility, and the Olympics doesn't even compare. So it was very refreshing. I started crying during that because I was like, I think I've suppressed and stuffed to this day. Even we went through, I'm remarried. I have an IVF baby, but went through IVF a whole round with the top provider in the country and failed. No embryos in April. And I was like you, my son we had 2 genetically normal embryos, transferred them, got one. So like did it one time and it worked. And so I'm sitting here. Yes, I know I'm older. I mean, let's be real. I wasn't in a great place. Like I'm really pivoting a lot in my own health right now, but I'm judging. I'm like, seriously, she's on her 5th kid? Who needs 5 kids in 2025? Like, I think everything that we're all thinking, it's a matter of allowing it to pass through us and feeling it and knowing you're not a bad person and then just being done with it. Unfollow that person. Don't go to the events. You do not have to go to the birthday parties and the baby showers. Like, I tell people, like, you have diarrhea. Just tell me you have diarrhea and you're puking. I don't know. Like, that'll get you out of everything, right? Literally. No one wants you to be there with diarrhea. It's just like, use it. Here's your card. You get to use it. And so it's acknowledging, like, I don't know why we feel we have to go to these things. Just say no, don't go. And you're still a good person. But really dealing with the mental health piece of it too. I've done a lot. I do the counseling, but I love hypnotherapy. I've tried some other tools. Like, that's working better for me than talk therapy did. It's digging deeper and I changed clinics because my clinic just wasn't jiving. I need someone who's going to be into the peptides and all the crazy rampamycins with me and let me do all the weird things and just support me and do that. So it's finding a provider who will sit beside you, not judge you. They don't care. Even if they don't agree, they're like, I don't know about it. Just go do it though. Finding a provider who jives with you, but really finding that mental health component and making sure you're supported, finding groups of people or even one person. I was closer friends with people on social media, on Instagram, than I was with those local when I was going through it because they got it more. I was going through the same thing at the same time as them. And to this day, still connect with them and talk with those lovely ladies. But it's understand that support might look different. It might not be in person. It might be virtual, finding the resources online, and just knowing that there is a huge community out there, especially in the infertility space. We're here for you. There's coaches, lovely coaches nowadays that can help on various different areas too, including one of my dearest friends who I just hung out with this weekend, childless after infertility. If you walk away from all of this with no child, there's space for you too and resources for you too, not talked about. It's just not talked about enough. And we have to continue to break down every stigma. Maybe it's surrogacy, donation, egg, sperm, whatever. Like whatever road you take to become a parent or not at the end of it, there's support for you nowadays at time of recording more than there was a decade ago, and going through this.
Yeah, for sure. I think the one thing you should never say to someone who's going through it is just don't think about it. Try and relax. I can't tell you how many people said that to me.
Go
I'm
on
like,
vacation and get drunk. It's like, I'm sorry, what?
I not to think about it. And
Yeah.
I tried to explain to them, no, that's all I'm thinking. I'm trying, doing all the right things, but don't ever
No, we are
Yeah.
females. It is like, that is what our body is quite literally designed to do every month. Like I tell my patients too, I joke, I'm like, I know you're not trying to have a baby, but remember, you had a hysterectomy, your body's still trying to have a baby. As long as you have ovaries, right? You have perimenopause, your body's still trying to have a baby. Like every month, your body quite literally is going through the motions of producing an egg. Like, it don't care that that's not what you're interested in, right? So, like, that is what we're made to do. So to turn that off is, like, wild, because how about those people that, like, are trying to not have a baby? Like, you just turn that off, not think about it. It's just, like, wild. Or, like, the adoption comments. Like, we've all heard those. Why don't you just adopt? And I'm like, adoption's a beautiful gift for everyone. Why don't you adopt? Like, I kind of throw it back at them. Have you adopted lately? It's so cheap, right? Like,
Right?
it's not it's not a diagnostic treatment for a disease. Like, and that's great. It's a lovely gift that anyone can give, is that if they so feel inclined to. It's not on my heart, it's not for me, and it's just not for everybody. So the comments, it's like, what can I do to support you? How are you today? Check in on me. Is there anything I can do for you? Where are you at in your treatment? Like, just asking about it, and how are you doing? That the simple how are you doing without leading with advice when you've never been down the road is the perfect way to go.
Absolutely. And good segue into that. Where are you in your journey?
Yeah, it's a great question. I joke. I'm like, I'm hitting reset. I am actually, like, getting iron infusions, doing PRP, getting back on peptides. I'm going to do ovarian rejuvenation. That's a whole wild term. I haven't decided what clinic or who. After this weekend, I got options now, so I'll be sharing more about that. But I'm gonna my endometriosis was left in me for so long it destroyed my ovaries, my right one specifically, my tubes, to the point he called my husband in the middle of surgery and wanted to remove that. And my husband's like, we didn't talk about that. I don't think she's going to be okay waking up with that. Can you just leave it? We'll come back if we have to. Yeah. So as great and successful that my surgery was, there's still endo that he couldn't get out of me. So I'm really working on that. I'm working with my dear friend who's a gut health specialist, a vaginal microbiome, my gut health. I'm really, like, flipping my brain and going very basic and taking care. I with how great the growth has been for the clinic, it kind of burnt me on the inside health wise. So I'm kind of resetting my health. And then I will pick IVF back up probably in the spring or summertime and go down that road again and just kind of, we had to buy a new house. There's been get the clinic bill. Like, there's been, like, other babies that had to, like, come to fruition that I, like, needed to focus my time and energy on. And I was burning the midnight oil. Like, I was, like, just 12 to 16-hour days. And I was like, I can't go back into IVF in that state. So I'm, like, delegating and learning how to delegate. And that's been very hard for me. But
It's
it sounds
very
so
hard.
very hard. But it's a very, very basic thing I think I need to make part of my day more. So kind of just reframing my health. So I share all of that. I'll share all the weird things I'm doing. And I just got a new bottle of peptide I'm looking at here too. So I'll share all the stuff on my Instagram as always.
It. That's great. And I can't wait to follow your journey in the spring and summer. I know you have a book out. It's called Beyond Doubt. Do you
Yeah,
want
it's like cutie
to
right sitting right, I don't know, point there, yeah. So it's more of my gift of validating, to women about medical gaslighting, what it looks like. Where did some of these, cultural or the way we were born and raised to put some dirt on it, brush it off, maybe some of it's coming from that of how we approach our health, but really encouraging women to put themselves first. How can we be there for our work, our organizations, our communities, our family, our spouses, our kids, whoever, like insert whoever, whatever, our dreams, our own dreams, if we are not healthy and well. So I'm taking my own advice and kind of hitting reset, but it also walks women through what the heck is medical gaslighting? Like, what does it look like? And what are some things I can do? It even has some scripting. How can you navigate through if you do stay with your provider or you are with a provider who you think might be doing that? Or how do you break away and say, it's okay, I'm going to go see somebody else. You're just not for me anymore. And it's not this big divorce production, right? Like, we don't have to be married to this provider. You're not going to the family reunions with them. And even if you are, you should provide them with some up-to-date research, maybe drop a book on their desk. I don't know. But how we feel so like, we don't wear the same shoes we wore 10 years ago, likely, maybe. We don't have the same house from 20 years ago. We're not seeing the same provider from when we were teens and in our 20s, likely. And if we are, we're not feeling well, find a new provider just like we buy a new car, a new shoes, new purse, It's finding someone who fits the needs that we have now and making sure you feel heard and feel seen. You should walk out of those visits feeling good, not with more questions, not with icky feelings, feeling good with a good plan and getting results. It shouldn't take a year or two to get results. It should take months to get results, if not weeks, to see something pivoting in your health.
And how invigorating I can imagine how it must feel for patients to be able to, talk to you or talk to the other practitioners at your practice and know that they're being heard and
Yeah.
we don't feel crazy and walk out with, having that confidence because so many times I've walked out of doctor's offices, you said, more questions than answers, and then feeling like, I don't know, maybe it's this or maybe it's that. And they completely gaslit us. And I
Yes.
love that there's an option for people out
I thought it was very ironic. I just opened this message now. I had a 6 a.m. message from a patient on Facebook Messenger, and I had the time of recording today, and she said, "You literally helped save my life, and
there.
you have educated me on women's health and helped take away my daily pain I felt." And so I'm gonna cry if I keep reading it, apparently. But I do think that so many women are struggling silently with how they feel, whether it's pain or just I ask women, how do you feel the minute you wake up to the minute you go to sleep? Like, we should feel good. Like, fun fact, we should actually feel good. And if we don't, we have got work to do, and we've got to get you in the hands of somebody who can help you, because you deserve, with your time here on this earth, to do your passions and your purposes and feel good doing them. And we put ourselves last so many times. And when you get met with resistance by someone with big degrees, big, bold names and letters and plates on the wall, right? You eventually think you're crazy, and you eventually just be quiet, and you eventually just succumb to how you feel. And that needs to end, and it needs to stop. And that is medical gaslighting. If you are being met with anything other than options and opportunities and feel goods.
Yeah, if you have physical ailments and issues, and they're not getting fixed, then it's gonna turn into mental
Ugh.
health.
Yes, chronic
It
disease, irreversible
you're
chronic
you're
disease.
crying and thinking that you're crazy. Doctor Harding, this was amazing. I wish we had more time. But tell everyone where they can find you.
Yeah, so on TikTok, Instagram, I'm at Dr. Tara Harding. My podcast is Hopeful Hints for Women's Health and Fertility. Website, drtaraharding.com. Come say hi. Seriously, drop in. I am someone who's actually answering my inbox, saying hi. I want to hear your stories, and I want to connect with you too, and just help you feel seen, feel heard, point you in the right direction. And just to walk away with hope and know that there is hope for you. Like you said, those symptoms are red flags. They're red flags. Your body's trying to speak out. Don't ignore them. Do not.
Great advice. Dr. Harding, thank you so much.
Yeah, thanks for having me.
Of course.